Welcome to the world of cognitive behavioral therapy, or CBT. This powerful approach to mental health has helped millions of people worldwide manage their thoughts, emotions, and behaviors. In this video, we'll explore the foundational principles of CBT, how it works, and why it's so effective. Whether you're new to therapy or looking to deepen your understanding, this journey will provide valuable insights into the science and practice behind CBT. Let's start by understanding what CBT is and why it's considered a gold standard in psychological treatment. Cognitive behavioral therapy is a structured, time-limited form of psychotherapy that focuses on the connection between our thoughts, feelings, and behaviors. The core idea is that by changing unhelpful thinking patterns, we can influence our emotions and actions in positive ways. CBT is evidence-based, meaning it's supported by extensive research and clinical practice. It's used to treat a wide range of issues, from anxiety and depression to stress and relationship problems. Let's break down the key components that make CBT unique. At the heart of CBT lies the cognitive model. This model suggests that our thoughts influence our feelings, which in turn affect our behaviors. For example, if you believe you're not good enough, you might feel sad or anxious, leading you to avoid challenges. CBT helps you identify and challenge these unhelpful thoughts, replacing them with more balanced and realistic ones. By doing so, you can change how you feel and act in everyday situations. Understanding this model is the first step toward meaningful change. CBT doesn't just focus on thoughts, it also addresses behaviors. The behavioral component examines how our actions can reinforce negative thinking patterns. For instance, avoiding social situations out of fear can make anxiety worse over time. CBT encourages gradual exposure to feared situations, helping you build confidence and break the cycle of avoidance. By changing your behavior, you can create new experiences that challenge old beliefs and promote healthier emotional responses. CBT emphasizes the interconnectedness of thoughts, feelings, and behaviors. Imagine a triangle where each point represents one of these elements. A change in one area can influence the others. For example, challenging a negative thought can reduce anxiety, which may lead to more positive actions. This dynamic relationship is central to CBT and forms the basis for many therapeutic techniques. Recognizing these connections empowers you to take control of your mental health. One of the reasons CBT is so widely used is its strong evidence base. Decades of research have shown that CBT is effective for a variety of mental health conditions. Therapists use structured methods and measurable goals to track progress. This scientific approach ensures that clients receive interventions that are proven to work. By relying on evidence, CBT practitioners can tailor treatment to each individual's needs, increasing the likelihood of positive outcome. CBT is typically a short-term therapy, often lasting between 5 and 20 sessions. It's designed to be practical and focused, with clear goals set at the beginning of treatment. This approach helps clients see progress quickly and stay motivated. Each session builds on the last, with homework assignments and exercises to practice new skills. The goal is to equip you with tools you can use long after therapy ends, fostering lasting change. CBT is a collaborative process between therapist and client. Rather than simply receiving advice, clients are active participants in their own treatment. Therapists and clients work together to identify problems, set goals, and develop strategies for change. This partnership fosters a sense of empowerment and ownership over the therapeutic process. Collaboration is key to making meaningful progress in CBT. Major focus of CBT is learning to identify negative or distorted thoughts. These automatic thoughts often occur without us even realizing it, shaping our emotions and behaviors. Through self-reflection and guided questioning, clients learn to spot these patterns and bring them into awareness. This is the first step toward challenging and changing them. By becoming more mindful of your thoughts, you can begin to take control of your emotional responses. Once negative thoughts are identified, CBT teaches you how to challenge them. Cognitive distortions are common thinking errors like all-or-nothing thinking or catastrophizing. Therapists use techniques such as Socratic questioning to help clients examine the evidence for and against their thoughts. This process encourages more balanced and realistic thinking, reducing emotional distress and promoting healthier behaviors. CBT also explores deeper core beliefs and schemas, broad underlying ideas we hold about ourselves, others, and the world. These beliefs often develop early in life and can influence our automatic thoughts and behaviors. By identifying and modifying unhelpful core beliefs, CBT helps clients create lasting change. This deeper work can be challenging but is essential for addressing long-standing patterns. Behavioral experiments are a key technique in CBT. These are planned activities designed to test the validity of negative beliefs. For example, if you believe you'll embarrass yourself in social situations, you might try initiating a conversation and observe the outcome. These experiments provide real-world evidence that can challenge unhelpful thoughts and encourage new, more adaptive behaviors. Exposure is another important behavioral technique in CBT, especially for anxiety disorders. It involves gradually facing feared situations in a controlled and safe way. Over time, repeated exposure helps reduce anxiety and avoidance. This process empowers clients to confront their fears and build resilience, leading to greater confidence in daily life. CBT often includes homework assignments to reinforce learning between sessions. These tasks might involve tracking thoughts, practicing new behaviors, or completing worksheets. Homework helps clients apply skills in real-life situations, making therapy more effective. Consistent practice is key to making lasting changes and achieving therapeutic goals. Self-monitoring is a foundational skill in CBT. Clients learn to observe and record their thoughts, feelings, and behaviors throughout the day. This practice increases self-awareness and helps identify patterns that contribute to distress. By keeping track of your experiences, you can gain valuable insights and measure your progress over time. CBT encourages setting SMART goals: specific, measurable, achievable, relevant, and time-bound. Clear goals provide direction and motivation, making it easier to track progress and celebrate successes. Therapists work with clients to break larger objectives into manageable steps, ensuring steady improvement and sustained motivation throughout therapy. Cognitive restructuring is a core CBT technique. It involves identifying, challenging, and modifying unhelpful thoughts. Through guided questioning and evidence-based reasoning, clients learn to replace negative thoughts with more balanced alternatives. This process leads to healthier emotional responses and more adaptive behaviors, supporting overall well-being. CBT teaches practical problem-solving skills to address everyday challenges. Clients learn to define problems clearly, brainstorm solutions, evaluate options, and implement action plans. This structured approach reduces feelings of overwhelm and increases confidence in handling life's difficulties. Problem-solving is a valuable tool for building resilience and independence. Managing stress is an important part of CBT. Therapists often teach relaxation techniques such as deep breathing, progressive muscle relaxation, or mindfulness exercises. These skills help reduce physical symptoms of anxiety and promote a sense of calm. Practicing relaxation regularly supports emotional regulation and overall mental health. Mindfulness is increasingly integrated into CBT. This practice involves paying attention to the present moment without judgment. Mindfulness helps clients become more aware of their thoughts and feelings, making it easier to respond thoughtfully rather than react automatically. Incorporating mindfulness into CBT enhances self-awareness and supports lasting change. CBT is highly effective for treating anxiety disorders. Techniques such as cognitive restructuring, exposure, and relaxation help clients manage worry and reduce avoidance. By addressing both thoughts and behaviors, CBT provides practical tools for overcoming anxiety and regaining control over daily life. Depression is another condition commonly treated with CBT. The therapy focuses on challenging negative thoughts, increasing engagement in enjoyable activities, and building problem-solving skills. These strategies help lift mood and restore a sense of hope and purpose. CBT empowers clients to break the cycle of depression and move toward recovery. Stress management is a key application of CBT. By identifying stressors, challenging unhelpful thoughts, and practicing relaxation, clients learn to cope more effectively. CBT provides practical tools for reducing stress and improving overall well-being, making it a valuable resource for anyone facing life's challenges. CBT can also improve relationships by addressing communication patterns and emotional responses. Clients learn to identify unhelpful beliefs about themselves and others, practice assertiveness, and develop healthier ways of relating. These skills foster stronger, more satisfying connections with others. CBT is effective for children and teens, helping them manage anxiety, depression, and behavioral issues. Therapists use age-appropriate techniques such as games and stories to teach coping skills. Early intervention with CBT can set the stage for lifelong emotional health and resilience. CBT isn't just for mental health, it's also used to manage physical health conditions like chronic pain or insomnia. By addressing the thoughts and behaviors that influence physical symptoms, CBT helps clients improve their quality of life and cope more effectively with health challenges. CBT is a valuable tool in addiction treatment. It helps clients identify triggers, challenge cravings, and develop healthier coping strategies. By addressing both the psychological and behavioral aspects of addiction, CBT supports recovery and long-term change. CBT can be adapted to help individuals recover from trauma. Techniques such as cognitive restructuring and exposure are used to process traumatic memories and reduce distress. Trauma-focused CBT provides a safe and structured environment for healing and growth. Obsessive-compulsive disorder, or OCD, is often treated with CBT. Exposure and response prevention, a specialized technique, helps clients gradually face fears without engaging in compulsive behaviors. This approach reduces anxiety and helps break the cycle of obsessions and compulsions. CBT is effective for treating eating disorders by addressing distorted beliefs about food, body image, and self-worth. Therapists work with clients to develop healthier eating patterns and challenge negative self-perceptions. This comprehensive approach supports recovery and long-term well-being. CBT for insomnia, known as CBTI, helps clients change thoughts and behaviors that interfere with sleep. Techniques include sleep hygiene education, stimulus control, and cognitive restructuring. This approach is often more effective than medication for long-term sleep improvement. Chronic pain can be managed with CBT by addressing the thoughts and behaviors that contribute to suffering. Clients learn coping strategies, relaxation techniques, and ways to stay active despite pain. CBT empowers individuals to improve their quality of life and reduce the impact of pain. CBT helps individuals manage anger by identifying triggers, challenging unhelpful thoughts, and practicing relaxation. Clients learn to respond to anger in healthier ways, reducing conflict and improving relationships. These skills support emotional regulation and personal growth. Building self-esteem is a common goal in CBT. Clients learn to challenge negative self-beliefs, recognize strengths, and set achievable goals. This process fosters a more positive self-image and greater confidence in daily life. Perfectionism can lead to stress and dissatisfaction. CBT helps clients set realistic standards, challenge all-or-nothing thinking, and develop self-compassion. These strategies promote balance and reduce the pressure to be perfect. CBT can enhance social skills by teaching effective communication, assertiveness, and conflict resolution. Clients practice these skills in therapy and real-life situations, leading to more satisfying interactions and relationships. Major life changes, such as moving, starting a new job, or experiencing loss, can be stressful. CBT provides tools for coping with transitions, managing uncertainty, and building resilience. These skills help clients adapt and thrive during periods of change. Grief is a natural response to loss, but it can sometimes become overwhelming. CBT helps clients process their emotions, challenge unhelpful thoughts, and find meaning after loss. This supportive approach fosters healing and adjustment. Health anxiety involves excessive worry about illness. CBT addresses these worries by challenging catastrophic thinking and encouraging balanced perspectives. Clients learn to manage uncertainty and reduce health-related distress. Phobias are intense fears of specific objects or situations. CBT uses exposure and cognitive restructuring to help clients gradually face their fears and change unhelpful beliefs. This approach reduces avoidance and increases confidence. CBT is effective for treating panic disorder. Clients learn to understand panic attacks, challenge catastrophic thoughts, and practice exposure to feared sensations. These techniques reduce the frequency and intensity of panic attacks, restoring a sense of control. Generalized anxiety disorder, or GAD, involves chronic worry about many aspects of life. CBT helps clients identify worry triggers, challenge unhelpful thoughts, and practice relaxation. These strategies reduce anxiety and improve daily functioning. Post-traumatic stress disorder, or PTSD, can be treated with trauma-focused CBT. Techniques include cognitive restructuring, exposure, and relaxation. This approach helps clients process traumatic memories, reduce symptoms, and regain a sense of safety. CBT teaches valuable life skills such as emotional regulation, communication, and problem-solving. These skills support mental health and well-being, helping clients navigate life's challenges with greater confidence and resilience. Summary: cognitive behavioral therapy is a structured, evidence-based approach that empowers individuals to change unhelpful thoughts and behaviors. By learning practical skills and strategies, clients can improve their mental health and quality of life. Whether you're considering CBT for yourself or supporting someone else, understanding its foundations is the first step toward positive change. Thank you for joining us on this journey through the essentials of CBT.